Imagine losing control of your hands and legs, having numbness and tingling sensation in your hands and feet, difficulty in walking or swaying while walking, imbalance while walking, having stiffness in your lower limbs or clumsy hands and clumsy feet. Terrifying, right? Today we will discuss about a condition called cervical myelopathy. Hey guys, we are back. I am Dr. Sukumar Sura, Senior Neurosurgeon, Specialist in Endoscopic Spine Surgery. Today we will discuss about a condition called cervical myelopathy. When you say cervical myelopathy, cervical means your neck, and neck has 7 spinal bones, or we call it as vertebrae. Inside the vertebrae, your spinal cord travels down from the brain towards lower spine. Myelopathy means dying of your spinal nerves or damaging of your spinal nerves. This we call it as cervical myelopathy when the nerve damage is happening in the neck, that is the cervical spinal cord. We call it as cervical myelopathy. When we understand cervical myelopathy, the commonest causes are the disc prolapse, that is the disc bulging out multiple levels, or the ligament which is there in the back of the spinal cord getting thickened, or there is bony spurs, the extra growth of the bone, or sometimes trauma. These causes either squeezing of the nerves or compression of the nerves leading to death of this spinal nerves. You can understand someone is squeezing or holding the spinal cord from front and back. This creates a lot of pressure on the spinal cord, causes blood supply to reduce or sometimes stop and lead to damage in the spinal cord. Commonly, when we say cervical myelopathy, once this progresses, patient starts having weakness either in their hands or legs. The legs becomes too stiff and patient starts having difficulty in urination or defecation. These all symptoms, the signals coming from the brain down, are affected in the spinal cord and cervical spine. This progresses further, patient completely might become bedridden, leading to complete weakness of all 4 limbs and losing both bladder and bowel function. Most of the time, visit a doctor, either a surgeon or a spine specialist or a neurosurgeon. Clinically, we can examine them. By the time we end of their examination, we can know that patient has something in the cervical spine going on. We can order MRI or CT scan where we can specifically understand where is the compression, how much significant is the compression, what is that causing compression, whether it is a disc, ligament or bone, we can understand very clearly. There is sometimes we see what is called as myelomalacia, where there is a white spot in the spinal cord on MRI, which denotes already there is some damage happening in the spinal cord. Once this is diagnosed clinically and radiologically, we definitely offer some treatment to the patient. Often patients neglect their condition because they think the symptoms are coming from vitamin deficiency or something else due to some minor illness. When you have symptoms like these, patient should never ever neglect these, because when patient has cervical myelopathy, small injury in the form of whiplash injury, going in a car or in a small fall, neck has a flexion extension movement acutely, patient can completely become paraplegic or quadriplegic. What do I mean by that? Patient can lose the power in their hands and legs completely. So that's why it should not be neglected by anyone. Whenever you have symptoms like these, which I mentioned earlier, he should immediately go to a specialist seeking for help. Once we see them, most of the time we tend to tell the precautions, have something wear a cervical collar, then do some simple exercises for the neck. If MRI shows significant compression or patient clinically has many symptoms and signs of compression, then we offer them surgery. Traditionally, cervical myelopathy, once it is decided to be operated, it can be done either from the front or from the back. When we go from the front, we tend to either remove the disc at multiple levels, or along with the disc we remove the bone and fix it from the front after compressing the spinal cord, which is little bit extensive surgery for cervical myelopathy. Second option is going from the back, where we put a long incision and split the muscles and remove the bone, compressing the nerves from the back and fix it or leave it. So either you decompress the nerves from the front, the spinal cord from the front, or from the back. This is the main goal or motto of the surgery, where you need to decompress the spinal cord. We see whether pathology is from the front or pathology is from the back. Depending upon that, a decision is taken either it should be done from the front or the back. This can be done either with microscope, endoscope, and various methods. Today we follow most of the time minimal invasive principles. The latest addition or boon to the patients in the treatment of cervical myelopathy is we use endoscopic technology today, going from the back and operating multiple levels with either one opening or two openings. With a small 8 mm incision, we can do 3 levels, 4 levels, 5 levels, 6 levels decompression of the cervical spine with this endoscope. As a result of which, patient morbidity, the morbidity of surgery, where putting a long incision from the back, splitting the muscles, causing lot of blood loss, and also muscle trauma and bone damage and need of implants, can be avoided with this endoscopic technology, which helps especially in elderly patients, where you need not do a big surgeries for them, giving the same benefit as open surgery. If we do endoscopic surgery for cervical myelopathy, that is from the back, because we are doing with a small single hole or small 2 hole, most of the time patient is made to walk in the evening and discharge the same day or the next day. Because the incision is not big, we are not putting any implants, that is metal, we are not fixing the spine. The amount of neck pain which is there in open surgery, here that pain is not there, so they can get mobilized within a few hours after surgery, and they can remove their cervical collar in a week or 2. This is a big advantage of cervical myelopathy done by endoscopic spine surgery, where return back to work is faster. Always remember, once spinal cord cells are damaged, they are gone forever. So always treat them before they get damaged permanently. Whatever way you choose, treatment is the key.